Welcome to HiNZ 2018, and I'm here this afternoon, excuse me, this morning, it's still morning, isn't it? I'm here with Professor Samson Tse, and Samson is Associate Dean Convenor of Mental Health Policy and Research at the University of Hong Kong. And Samson wowed us yesterday on a presentation on 5G, where you began by talking about augmented reality, and you got our attention by saying that Team New Zealand had just announced that they were going to be using augmented reality in the America's Cup. Yes. And then you went on to tell us about your views on 5G and the 4+1G and what that really meant to achieving the success. So can you elaborate on that, Samson?
Well, the first G is really about globalization. I think what we need to do is to look at both globalization going around the globe, but also sort of bringing people together, closing the gap. And I'm thinking in particular there's a term, hikikomori. It's a Japanese term to describe young people primarily socially withdraw from the society, but yet they don't have any sort of diagnosable mental disorder, if you know what I mean. But basically, they just isolate themselves. And I would say 5G, this kind of platform, internet, cyberspace will reach this group of people very well. So the first thing will be globalization, close the gap, and let's bring people together. The second G is very much to do with what I describe as let's do it genuinely good, genuinely well. So it's not just doing it for the sake of doing it, but doing it for the better health outcome and better wellness of humankind. And then the third G, I'm really talking about generation. My argument is very simple. If we just launch the 5G without a true, deep, thorough understanding of the new generation of service users, I think we missed the plot and basically lost a very precious opportunity to use this 5G enhanced platform to do something good. So I think that really sort of requires us to go deeper, truly understand service user oriented kind of delivery mode, instead of sort of business as usual. But now look, we have a screen, we have a fancy device here, and then my last G is also important, is gatekeeping the security of data, gatekeeping the standard practice. One thing in particular I should mention is because of the 5G generation, I'm sure there will be even more and more apps, health-related apps. Then the question is, we need to gatekeep the quality of those gadgets and programs and devices. Without that, I think we'll be wasting people's time. If you don't mind me saying that, a lot of health products on the market is exactly sort of like that. So I think we need to gatekeep the quality of those quickly, rapidly expanding market of apps with the 5G coming on board. And then those 4G, everything works well, converge together to meet what I call the grand mental health challenges. And I think we need to look at that. I mean, on my slide, I talk about the three very pressing conditions in mental health are depression, anxiety disorder, and then alcohol use disorder and drug use disorder. And we have been sort of approaching those conditions with more approaches and treatment methods. But I think now with the 5G, golden opportunity to think about alternative delivery mode that will reach people effectively.
Mm-hmm. So because mental health is a major priority now for our own here in New Zealand government. So what would just be a couple of examples, if you put the 5G hat on, we're looking into the future, some very specific examples, because your background is very extensively in mental health. Wow. But what would be perhaps an app example?
I would say an app for caregivers of loved one affected by mental disorder, my particular field is people with bipolar disorder. Bipolar disorder is a devastating condition. I can be functioning very well, but when I'm unwell, affected by the high mood or the low mood, very suicidal, I'm pretty useless. So as a family members, I have concern about my loved one, how his or her mood is doing, and importantly, how my family member is keeping well. So I would say, let's have a apps supporting caregivers, family members with loved one affected by the condition. And this app should have the following functions, e.g., a good peer support group, so I'm not alone, I can sort of reach out and talk to people. E.g., that apps should have sort of good evidence-based clinical information in terms of what to do, how to do, where to get help, and so forth. And also, I would say the last one is with apps, me as a family member being in control, I can access different information about the condition. I think is very, very important as well. And again, being able to interact, to share with people with similar experience, looking after loved one, to understand the joy, the frustration, the reward, the closer loving relationship, together with the frustrations, and in some cases maybe anger as well. So all these mixed emotions to be able to share and catch up with people is very, very important. But the main thing about having an apps like this is I'm in control 24/7. And also I know it's a secure network with like minds, people with similar experience. All these are very important because we know family members, caregivers, they're super busy. They can't go to a support group at 3 p.m. because I still have a job to do, all those things. So the multimodal, 24/7, secure, like minds, equally loving, mutually sort of supporting each other, very important.
Because that's the sort of thing that will make a difference,
Oh,
isn't
absolutely.
it? And it brings some humanity to it. That's really fascinating, and we're looking forward to 5G, Samson. I just wanted to, you gave a quote at the very end of your paper that really stuck with me from Stephen Hawking. And if I just paraphrase, but he was basically saying, let's make sure that wisdom wins over the technology. I've paraphrased it, but I thought that was really a quite a poignant way to describe it, that we have the technology, but we have to use it smartly and humanely and with wisdom. So Samson, thank you very much. Your presentation and slides are going to be on the HiNZ website for everyone to listen to afterwards. Thank you.
Lovely. Thank you.